Hi, welcome to Innovate Training. My name is Carol Peugeot, and this is Understanding HIPAA for the Medical Office. We are on our Lesson 5, Transactions and Code Sets. And so what are we going to learn today? Well, first of all, we're going to talk about the need for national standards for electronic transactions. Electronic transactions is just a fancy word for things that are going to be transmitted electronically, whether it's a claim or whether it's some other type of communication. We're going to identify the code sets mandated by HIPAA, and then we're going to understand the enforcement guidelines set up by the Department of Health and Human Services, or otherwise known as DHHS. Well, in today's information age, the phrase electronic transaction is a very common nomenclature in today's modern language. With computerized banking, electronic bill paying systems, and computerized tax reporting systems, it's not a far stretch to think that health information is now being transmitted electronically. Because of this, HIPAA has mandated the use of standardized code sets for certain pieces of information. So in a nutshell, computerized transmissions of claims have replaced paper claims. So in other words, 20 years ago, a physician who was going to bill the insurance company for a patient's services would print up a paper claim, which was called a CMS 1500, and put it in an envelope and then mail it to the insurance carrier. Well, today what they do is they print up a claim form, or rather they create a claim form on the computer, and instead of printing it and mailing it, it is sent via the internet and it's received instantaneously. There's also, HIPAA standardizes the use of the code sets for standardized scrambling software for electronic transmission of claims. So in other words, these claims are being sent out electronically. The information, as we discussed earlier, needs to be encrypted so that it's not able to be intercepted and therefore altered or stolen as far as the patient's information. And then also the use of codes for diagnoses and procedures. And these are our CPT or ICD-9 or HCPCS codes, or as of October 2014, our ICD-10 codes. And then non-medical codes for administrative purposes. Electronic Protected Health Information, otherwise known as EPHI. Well, federal mandates call for the constant flow of healthcare information. In order to achieve this, health information must be formatted in a consistent way so that health plans, healthcare providers, and clearinghouses can communicate with each other. Just as if you were in an office and trying to communicate with the person across from you and you didn't speak the same language, you would not be able to communicate. Well, it's the same way. The standardized code set is a common language between these entities so that they can effectively communicate with each other. Well, as of February 2003, a final rule titled Modifications to Electronic Data Transaction Standards and Code Sets was printed in the Federal Register. What this means is any transaction of electronic protected health information between any of the three covered entities that we discussed earlier must be translated or formatted into a federal standard. Under HIPAA, if a covered entity conducts one of the transactions electronically, they must use the adopted standard, either the ASC X12N or the NCPDP for prescription. And we're going to discuss these a little bit later in this lecture. The purpose of transaction standards. Banks, money exchanges, and other types of businesses have been using electronic format based on electronic data interchange for many years. The health insurance industry was the only major industry still using paper transactions. Well, the reason for this was due to the many different entities or parties that contribute to the healthcare systems. These include small doctors' offices or clinics or other healthcare providers who may not have had the equipment to go fully electronic until the last decade. Electronic data interchange. An electronic format is an arrangement of data elements that assist in identifying the contents of a transaction. Since EDI, many businesses have streamlined manual and tedious data entry tasks. For example, Banking systems used to hire individuals who would punch in check information. This tedious data entry task has been eliminated by new scanning equipment and software that remarkably can now be used in the healthcare industry for processing claims. So what does this mean for you? Well, in the medical office, what formerly took 4 to 5 people full-time can now be performed by one person in a couple hours. Well, you might say that this eliminates jobs, but rather, this new method of processing patient information has created higher-level specialized health positions in both the clinical setting, the administrative setting, as well as the health insurance settings. The Administrative Simplification provision of HIPAA. Besides protecting patients' privacy, another provision of HIPAA was to simplify the administrative tasks that go along with processing insurance claims. This passed with the support of the healthcare industry. By the year 2000, 300,000 companies had used EDI. The electronic system is defined as a computer-to-computer transmission of business information. A code set, any set of codes used for encoding data elements such as table of terms, medical diagnoses, or medical procedures. A code set rule designates certain sources to be used to code these items. Let's talk a little bit about these code sets. For instance, the first one we're going to talk about are the HCPCS, or otherwise known as the Healthcare Procedural Coding System. It's nicknamed HCPCS. There are 3 levels. Level 1 is known as the Current Procedural Terminology, 4th, or CPT-4. The Level 2 are the Medicare Level 2, commonly referred to the HCPCS. And then Level 3 are the local codes, which due to HIPAA's laws are no longer used. Well, Level 1 is, again, the Current Procedural Terminology, CPT-4. This is used to code services and procedures for outpatient services or physician services. It's created and maintained by the American Medical Association, or AMA. It contains 5-digit numeric codes with 2-digit modifiers. Some examples are a 99213, which would be a mid-level office visit, a 10040, which would be a surgical excision of a lesion, a 28282, 28282, which would be a hammer toe procedure, with the 50 as a modifier, meaning it was done as a bilateral. Bilateral meaning 2 sides, right and left. Level 2 codes, these are Medicare's Level 2s, for use with medical supplies and services not found in Level 1, or the CPT coding manual. These contain codes for such items as durable medical equipment, DME, or other supplies. These are created and maintained by Medicare, or otherwise known as Centers for Medicare and Medicaid Services, CMS. These are 5-digit alphanumeric codes. For example, the first letter would be an alpha code. For example, J1004, E0043, D2445 are all examples of a Level 2 HCPCS code. Level 3, these are local codes used by Medicare's regional fiscal intermediaries. This is an intermediary, by the way, is an entity that processes claims for Medicare. Well, due to HIPAA's standardized code sets, Level 3 codes have been discontinued. Coders should refer to HCPCS Level 1 or Level 2 codes for outpatient and ICD-9 Volume 3 for inpatient procedures. Next, we're going to talk about the ICD-9, otherwise known as the International Classification of Diseases, 9th Revision. This is created and maintained by the World Health Organization, or the WHO. It contains 3 volumes. Volume 1 is a tabular listing of diseases. In other words, it's listed by numerically. Volume 2 is the alphabetical index to diseases. It's listed alphabetically. And then Volume 3 is the tabular and alphabetical listing of the inpatient procedures. Well, let's talk a little bit about the ICD-9. ICD-9 has 3 volumes. The first 2 volumes are used for diagnostic coding. Diagnostic coding is coding for the diagnosis or the injuries that the physician assigns to that patient encounter. For coding diagnoses, a healthcare provider would refer to the ICD-9 CM coding tool. The first volume they would refer to is Volume 2 because it's an alphabetical listing. In other words, it's listed alphabetically, so it's the only way the coder would be able to find the particular disease or injury. For an example, for a fracture of the tibia, the coder would go to Volume 2, which is alphabetical, and they would find the fractured tibia. Probably look under fracture and then under fractured tibia, and then it would give you a code. From there, you would go to Volume 1, which is a tabular listing, which lists them numerically. So you would take the code that you found in Volume 2, in Volume 1, and find the description. Then you would read the description and check it against the medical documentation. Does the description match? If it does, then you have the proper code. What does an ICD-9 code look like? Well, it's 3 to 5 digits, and it's a numeric. For example, I've listed 3 of them here, 3 to 5 digits. 3 digits require just 3 numbers. 406 is an example. The next one, 403.0. Any digit past the 3rd digit requires a decimal. 403.0 is 4 digit. Or 5 digit, 403.01. Remember that decimal needs to be there after a 3rd digit. An exception to the numeric codes in the ICD-9, we have 2 sections called V codes and E codes. The V codes are ICD-9 codes that indicate services rendered where there's no particular disease or injury. An example of this would be a physical examination. The coder would use a V code instead of finding a diagnosis code. E codes, on the other hand, indicate external causes, such as an automobile accident or poisoning. This would be used in conjunction with a regular diagnosis code. In other words, an E code would only be a secondary code to describe how something happened or why something happened. Next, we'll talk about Volume 3 of the ICD-9 coding tool. Volume 3 is for inpatient procedure coding. These are 4-digit codes used by hospitals to report services and treatments performed in an inpatient setting. Software called encoder is used to assist with the coding path due to the fact that the hospital coding is much more complicated and extensive than physician or outpatient coding. We talked a bit about ICD-9, but as of October 2014, the ICD-9 coding system will be discontinued, and the newest revision will be used. The newest revision is called International Classification of Diseases 10th Revision, or ICD-10. In this revision, Volume 3 of the ICD-9 will now be called ICD-10 PCSs for procedures. Codes will have 5 to 7 digits as opposed to the 3 to 5 digits. Now, while the codes are changing, there's going to be many more codes, and the reason for this is that the ICD-9 was created in 1978, and many more disease processes have been discovered since then, and the ICD-9 coding system has run out of codes and is no longer expandable. Well, the coding system in the ICD-10 was created in a way that is much more easy to expand. So watch for this as of October 2014. If you haven't received any ICD-10 training and you're interested, Innovate Training will be offering ICD-10 training, and this could be found on the Innovate Training website. Next, talk about dental codes. Dental codes are contained in 2 different sources. They can be found in the CDT, Current Dental Terminology version 4, or the HCPCS level 2. The chapter for dental codes begin with the character D, followed by 4 numeric digits. An example would be D1001. This is created and maintained by the American Dental Association, or the ADA. Let's talk about drug codes. The Department of Health and Human Services has designated that drug codes are to be coded from the National Drug Code, or NDC, system. This is established under the Medicare program, and it serves as a universal product identifier. It's updated by the Department of Health and Human Services in collaboration with drug manufacturers. Details about any drug can be found at the website for the U.S. Food and Drug Administration, or www.fda.gov. Non-medical codes. These are strictly for administrative purposes. These codes do not refer to any kind of medical care of a patient, so it doesn't refer to any procedures or any diagnosis of the patient. These items include such things as the state abbreviations, the zip codes, the race and ethnicity codes. These are used in electronic transactions to identify physician's information, claim status, and provider organization type. The ASC X12 nomenclature. The National Uniform Claims Committee, or NUCC, was given the task of developing a method of transmitting transactions formerly sent on paper claims, called the CMS 1500 form. The NUCC outlines how and in what order the information is to be sent through the electronic data interchange. The ASCX12N. This is a standardized language whereby electronic claim forms are sent to and from third-party payers, or otherwise known as insurance carriers. The ASC stands for Accredited Standards Committee. This is the given authority to develop these standards. Architecture. The ASC set up templates for these electronic transactions. These are the first templates accepted by the federal government to send and receive electronic protected health information between providers and payers. The healthcare provider is responsible that the software they use for transmission is compliant with these HIPAA standards. Electronic claim forms. For inpatient billing, they use the electronic version of the UB04. UB04 stands for Uniform Billing 04, which is generated by the hospital's charge master, and the encoder is the software used to generate correct codes. For physician or outpatient supplier services, they use the electronic version of the CMS 1500 form. This is transmitted through a clearinghouse to third-party payers. A remittance advice, or RA. Each health plan generates its own version of this form. It's generated by the payers that indicates what services are paid, the dates of service, how much is paid, denial codes if claim was denied, and how much the patient is responsible. Medicare's version is called the ASCX12N835. Well, in summary, the information age is driven by numeric digits, since this is the basic language that computers understand. Everything from diagnoses, procedures, to claim format has been converted to codes. While this can be confusing, the healthcare professional's job has been made much easier by the use of HIPAA-compliant software. Well, I hope you enjoyed this lecture. My name is Carol Peugeot from Innovate Training. Please contact me with any questions or comments that you have regarding this course. Please be sure to take the assessment after this lecture to help you better with the questions that are going to be on the HIPAA final exam. So until next time, we'll see you next lesson. Bye.